Hi, my name is Dr. John Thomas. You are watching this video because either you or someone you love suffers with a chronic health condition. What I'm going to do in this video is explain to you the concept of leaky gut syndrome or intestinal permeability. Now, the best way to describe what leaky gut is to picture a screen door. Now, your screen door is designed to let air flow freely through, but to keep the bugs out. Our intestinal lining works very much the same way. It's designed to let smart particles through from the foods we eat, but to keep larger particles out, like undigested food particles, pathogens, whatnot, from crossing our gut barrier to get into our system. Now, when you get a compromise in your gut barrier, okay, or what we call leaky gut syndrome, okay, it can eventually lead to symptoms. Now, leaky gut can happen multiple ways, and we're going to talk about 3 ways that are commonly associated on how our gut breaks down today, and what we can do to test for that to see which one of these mechanisms are compromised in our gut. So the first one we're going to talk about is what we call intracellular breakdown. Okay. Now, our gut lining, our cells, okay, they connect together through what we call tight junctions. Okay. Now, due to stress on our gut lining, antibiotic use, food sensitivities, inflammation, whatever it is, in time, those tight junctions can tear apart. Okay? So we can actually see a tear in our tight junctions, and then our larger particles, like undigested food, can cross through the gut barrier into our blood. Okay? That is one way leaky gut can happen. Right? Inflammation, food, whatever it is, can tear those tight junctions, things cross that are not supposed to cross, gets into our bloodstream. Okay? Well, how do we know that's happening? Okay? What we can do is we can actually test for zonulin and inclutin antibodies. Okay? Those zonulin and inclutin are the components that hold those tight junctions together. Right? Now, when the tight junction tears, you get food particles through, our immune system recognizes the zonulin and inclutin as foreign, builds antibodies to those, so we can test for that to see, are you having an intracellular breakdown of your gut barrier? The second way leaky gut can happen is known as transcellular breakdown. This is where we actually will get not so much as a tear or separating the tight junctions, but the cell itself will actually just rip open, okay, due to a toxic load or a stress on it. So we actually will get the cell to rip in half, and then our particles will cross through that way into our bloodstream. Okay? Now, how do we test for transcellular breakdown? What we do is we look for what we call actomyosin antibodies. Okay? So when that cell tears, our immune system can build antibodies to actomyosin, which is a part of the cellular component holding that the actomyosin cytoskeleton, which forms that cell, and we'll get actomyosin in the bloodstream, and our immune system will build antibodies to that. That is a way we can test for transcellular breakdown of our gut lining. Okay? The third way that leaky gut syndrome can happen is what we call malabsorption. Okay? This is where we get a sludge layer or an inflammation layer across the top of our intestinal lining, which will actually decrease what we can absorb nutrient-wise. Okay, so we get a malabsorption of nutrients due to just increased sludge or inflammation along the gut lining. Okay, now this happens due to pathogens, meaning a bacterial infection, parasitic infection. Okay, those are the most common ways that we get this sludge layer that lays down, that wreaks havoc on our various systems and will lead to malabsorption. So how can we test for that? Well, we can test for what we call lipopolysaccharide antibodies. Okay, lipopolysaccharides are pretty large particles that are found on the outer wall or outer membrane of gram-negative bacteria, and they are not supposed to be there. So what we can do is we can just see if we have antibodies to lipopolysaccharides, and if we do, we know we have got that third pattern or mechanism of leaky gut, and we know what we got to do to go investigate, looking for some type of parasitic or bacterial infection causing a breakdown in your gut barrier. Okay, Leaky gut syndrome is common, right? It can happen many ways. Like I said, these are the mechanisms. These mechanisms happen due to lifestyle, due to food sensitivity, due to medication interactions, multiple things that will compromise our gut barrier systems. Now we know that there's different mechanisms we can test for and what we can do to address and fix and strengthen these mechanisms that are leading to symptoms. Okay? My name is Dr. John Thomas. If you'd like more information or learn how to become a patient, please call my office at 678-456-9122 or visit us on the web at integratedhealthcarega.com. There you'll find many more videos and resources that explain what we do in our office, as well as why you feel the way you do and why you have symptoms with your chronic condition. I want to thank you for spending the last few minutes with me, and I look forward to reinventing your life. Thank you.